This video will show you how to perform the exercises you'll need to do after your breast surgery. This video is for patients who have not had reconstruction. This module will teach you how to perform exercises that will help you regain full use of your arm on the side where you had your surgery. This is called the affected side. You can also review these exercises in the booklet your nurse gave you, Exercises After Breast Surgery. Start doing the exercises shown in this video on the first day after your surgery. These exercises are designed to help you regain full range of motion in your affected arm. This means you'll be able to move your arm over your head, out to your side, behind your neck, and to the middle of your back. Do these exercises 5 times a day until you have regained full range of motion and are able to use your arm as you did before your surgery in all of your normal activities, at work, at home, and in recreation or sports. If you had limited movement in your arm before surgery, your goal will be to regain as much movement as you had before. Some women regain full arm motion fairly quickly after surgery. After your range of motion has returned to normal, continue doing the exercises once a day, especially if you still feel some tightness in your chest, shoulder, or under your arm. The exercises can help prevent scar tissue from forming in your armpit and shoulder. Scar tissue can limit your arm movement later. If you continue to have difficulty moving your shoulder 4 weeks after your surgery, tell your surgeon. He or she will determine if you need further rehabilitation. While performing these exercises, or even while doing your normal activities, you may experience various types of sensations on your affected side. During the first few weeks after your surgery, you may notice some discomfort or pulling along your incision while doing some activities. If this happens, stop or limit the exercise or activity until your arm is once again moving comfortably. Once your incision has healed, don't be afraid to stretch. Slow, gentle stretching at this time will not cause your incision to open. It will help you regain full use of your arm. You may also experience what is known as referred sensations in your upper arm, forearm, shoulder blade, or rib cage area on your affected side. These sensations occur because nerves in your skin were affected by your surgery. Patients describe these feelings as sensitivity, numbness, tingling, twinges, or burning. Not all patients feel them in the same way or with the same intensity. They usually diminish with time as your nerves heal. Referred sensations may be uncomfortable, but they're normal and should not interfere with your daily activities or exercises. If the sensations become too bothersome, talk with your surgeon. He or she can recommend other treatment options. You may also experience phantom sensation. This is the feeling that your absent breast or nipple is still there. This sensation is also normal and will diminish with time. To ease some of this sensation, you can apply light pressure with your hands, a towel, or pillow to the area. Exaggerated deep breathing will help you with your exercises and make it easier to relax. Sit comfortably in a chair and take slow, deep breaths through your nose. Let your chest and belly expand. Now exhale slowly through your mouth. This can be repeated several times. This breathing technique is useful when you do your exercises because it can ease discomfort or tightness around your incision. Also, this is a very good technique to relieve tension throughout the day. Now, a therapist will demonstrate the exercises for you. Do 10 repetitions of each exercise, 5 times a day, until you can move your affected arm the way you did before surgery. 2 of the exercises will require tape to mark your progress, so have 4 pieces ready before you begin. You may also find it helpful to have a stopwatch, timer, or watch with the second hand nearby, as you will need to hold some of the exercises for a full minute. Shoulder rolls. The shoulder roll is a good beginning exercise since it provides a gentle stretch to the chest and shoulder muscles. Stand or sit comfortably with your arms relaxed at your side. In a circular motion, bring your shoulders forward, up, backward, and down. Try to make the circle as large as you can and get both of your shoulders to move at the same time. If you have some tightness across your incision or chest, begin with smaller circles, but increase the size as the tightness lessens. You may find that the backward direction is a little tighter across your chest. This will get better with practice. Now, switch directions and do 10 shoulder rolls in the forward direction. Bring your shoulders backward, up, forward, and then down. Arm circles. If you had surgery on both breasts, do this exercise with both arms, one arm at a time. Do not do this exercise with both arms at the same time. This will put too much pressure on your chest. Stand with your feet slightly apart for balance. Raise your affected arm out to the side as high as you can. Begin making slow, backward circles in the air with your arm. Be sure the movement is occurring at your shoulder and not at your elbow. Keep your elbow straight. Increase the size of the circles until they are as large as you can comfortably make them. Be sure to complete at least 10 full backward circles. If you feel any aching or if your arm is tired, take a break. Continue your repetitions when you feel better. Slowly lower your arm to your side. Rest your arm for a moment. To perform the second part of the exercise, raise your affected arm out to the side at shoulder height. Begin making slow forward circles. Increase the size of the circles until they are as large as you can comfortably make them. Be sure to complete at least 10 full forward circles. If you feel any aching or if your arm is tired, stop before 10 circles. Lower your arm to your side. W exercise. This exercise can be done standing, sitting, or lying on your back. Doing this exercise with your back against the wall may help you position yourself properly. Form a W with your arms out to the side and palms facing forward. Try to bring your hands up so that they are even with your face. If you can't raise your arms that high, bring them to the highest comfortable position. Pinch your shoulder blades together and downward, as if you were squeezing a pencil between your shoulder blades. If you feel discomfort in the area near your incision, stop at that position and do the deep breathing exercise. If the discomfort passes, try to bring your shoulder blades a little closer together. If the discomfort does not pass, stay at your current position. Hold the most comfortable position and squeeze your shoulder blades together and downward for 5 seconds. Slowly bring your arms back down to the starting position. Repeat this exercise 10 times. Back climb. This exercise can be performed in a sitting or standing position. Place your hands behind your back and grasp the hand on your affected side with your other hand. If you have had surgery on both breasts, use whichever arm moves most easily to assist the other. Slowly slide your hands up the center of your back as far as possible. Hold the highest position for 1 minute. If you feel pulling or stretching near your incision, stop at that position and do the deep breathing exercise. If the tightness goes away, try to slide your hands up a little further. If it's still there, do not slide your hands up further. Hold the highest position you can for about 1 minute. You should feel a gentle stretch in your shoulder area. After 1 minute, slowly lower your hands. Hands behind neck. Stand or sit comfortably with your feet on the floor. Clasp your hands together on your lap. Slowly raise your hands towards your head, keeping your elbows together in front of you and not out to the sides. Keep your head level. Do not bend your neck or head forward. Slide your hands over your head until you reach the back of your neck. When you get to this point, spread your elbows out to the side. Hold this position for about 1 minute. If you are not able to get into this position, reach up and stretch your elbows back as best you can. If you have some tightness across your incision or chest, hold your position and do the deep breathing exercise. If the tightness decreases, continue with the movement. If the tightness stays the same, hold the position you are most comfortable in for 1 minute. Breathe normally. Do not hold your breath as you stretch your body. Slowly come out of the stretch by bringing your elbows back in front of you and sliding your hands over your head. Then, slowly lower your arms to your lap. Forward wall crawls. You will need 2 pieces of tape for this exercise. Stand facing a wall. Your toes should be about 6 inches from the wall. Reach as high as you can with your unaffected arm and mark that point with a piece of tape. This will be the goal for your affected arm. If you have had surgery on both breasts, set your goal using the arm that moves most comfortably. Place both hands against the wall at a level that's comfortable. Crawl your fingers up the wall as far as possible, keeping them even with each other. Try not to look up toward your hands or arch your back. When you get to the point where you feel a good stretch, but not pain, do the deep breathing exercise. Return to the starting position by crawling your fingers back down the wall. Repeat the wall crawl 10 times. Each time you raise your hands, try to crawl a little bit higher. On the